So, hello, my dear children. Today we have gathered together for our class related to the social and health education, where we have been discussing in the previous class about your minerals and mineral deficiencies. So, in the last class, we have already discussed about your calcium deficiency diseases, the treatment measures, about iron deficiency diseases and magnesium deficiency diseases with your treatment measures. So today we are going to discuss about some more minerals and about their deficiency, disease symptoms and occurrences, and how we can treat this. So you can see here potassium deficiency and sodium deficiency. This why I'm taking these two together, because these are the two salts which generally are utilized in the electrolyte solution. When do we take this electrolyte solution? We need whenever we are suffering from some kind of health condition that is dehydrating our body, and at that time you're recommended to take the ORS, oral rehydration solution. So it is nothing but a salt solution of a salt mixture of sodium and potassium ions. Along with that you have the sucrose. So this, whenever there will be the deficiency of your sodium and potassium ions in the body, so that will cause an imbalance of electrolyte inside your body, where there will be excessive fluid loss from your body, and that will be associated with an imbalance with your blood pressure. There will be cardiovascular diseases occurring, and also with that there will be kidney problems. So that means these particular two salt ions are highly important for our proper health rehydration, as well as for the proper coordination and functioning of the vital organs of our body. More than sodium, it is recommended that we should take potassium in greater amounts and reduce the intake of sodium salt inside our body, as it is one of the natural salts found as potassium chloride in the sea. Further, there is one term called as hyponatremia, which is associated with low sodium intake. So with that, people also suffer from different problems, such as your the excessive of where this is a condition of excessive your dehydration, which is hyponatremia. Along with that, you suffer from the some other associated symptoms, where there will be pressure, negative pressure generated over the kidneys, and where you will be asked to take the diuretics, and with that you will have different symptoms which will be associated to your cardiovascular risks. So for potassium, you are recommended to take the leafy vegetables, the green leafy vegetables, broccoli, cucumber, along with the potatoes and sweet potatoes. Okay, then we can also take those cereals, lentils, then our poultry's pulses, then sea fish, okay, meat. So it is highly recommended to take. For in case of sodium, it is recommended that we take the in lieu of sodium chloride, we can take sodium nitrate and sodium bicarbonate, and also we can find sodium present in monosodium glutamate. However, monosodium glutamate is not highly recommended to be taken, as that also causes cognitive dysfunction, and that may also cause some kind of birth defects. So highly recommended products are your milk products like cheese, other milk products. You can take yogurt, poultry foods, breads, eggs, meat, etc. Then coming to the next mineral, which is zinc. Zinc is also equally important as our vitamin C, which is ascorbic acid, where the deficiency may cause immunodeficient problems, where there will not be enough of antibody production inside your body, and not only that, that will also cause some severe problems related to your growth retardation. So it is necessary that we take zinc in optimum amount, where we will find it in the meat, legumes, sea fish, peanuts, and other dry fruits, dairy products, whole grains, eggs, dark chocolate, yogurt, mushrooms, etc. Next is your iodine. So iodine, we are all aware about that iodine deficiency causes goiter. Not only that, it also it causes defects with the hormonal imbalance of secreted from the pituitary glands, where most of the defect is seen with the thyroid stimulating hormones, thyronin and thyroxine. Along with that, some other associated symptoms will be breathing problems, swallowing problems, and there will be cough, hoarseness of the voice, sore throat, throat pains, etc. So the RDA, which is the recommended dietary allowance to be taken for men, is around 150 microgram for iodine. In case of women, especially for the pregnant women, it is recommended that you take around 220 or minimum 200 to 290 micrograms of iodine. And for lactating mothers, it is recommended to take around 1100 micrograms of your iodine. Okay, so along with that, there are also certain food sources where the animal foods rich in proteins, sea food products, vegetables, cereals, milks, bread. So these are also highly recommended to be taken. And most importantly, generally we find that when you are taking any kind of food substance which is natural and generally known to present, to have all the presence of constituents, but along with that, if you can enhance or enrich the food product, then we are fortifying it. So for example, in case of bread, so we know that in bread you can find the sodium and potassium salts, especially the sodium. But not only that, if you are trying to enhance the constituent amount, increase the constituent amount, enrich it with more amount of minerals and vitamins, then it is said that you are fortifying your food item, you are fortifying your particular food product. So that is where is your now fortified bread, where you can also find the iodine constituent present. So that is a good point for us, isn't it? So this is all about the different minerals, mineral deficiencies, and the sources of the minerals which you should know. So that means we can say that most of the malnutrition is occurred because of this mineral deficiencies and your vitamin deficiencies. So we have already discussed in our previous classes about the different vitamins and their vitamin deficiencies, sources and their deficiency, diseases at a chronic level as well. So this is about your minerals. So I suggest you all that you go through this, make a chart, make a table of the vitamins, the common names of the vitamins, like you know that vitamin A, it is commonly known as vitamin A, but there is a scientific name which we call it as retinol. Okay, then your vitamin C is known as your ascorbic acid. Okay, vitamin K is known as what? Phyloquinone. Vitamin E is known as what? Tocopherol. Then your calciferol, vitamin D. So these things you should know. Okay, there are different types of your vitamin B complexes like your thiamine, niacin, etc. So you should know about this, and also your minerals. Make a chart and just keep a chart in front of your room so that you can memorize this more easily. Okay, and you don't get confused. So now after this, coming to the next topic, which is about your some avoidable habits. So one very most important avoidable habit is your drinking. So you know why? Because drinking is not a bad habit if you are taking it not as a drug. Drinking water, drinking juice is not a bad habit. But if you are drinking an alcohol which comes under a drug of misuse, or it can also be a drug of abuse, okay, which is both under the drug addiction. That means this is one such drug which can act as your CNS stimulant, CNS depressant, and it can also be a source of your many other conditions like anxiety, depression, and different carcinogenic your occurrences of different, maybe carcinogenic for your different cancer causing your diseases, okay, conditions. So here you see alcohol drinking is not bad, but alcohol drinking as being dependent on alcohol is harmful. If you are misusing without having the proper knowledge, then you should go for a proper counseling where you will understand that drinking of alcohol should be very much in a minimum optimized level, where a woman can take 1 drink per day if she is drinking, and a man can take 2 drinks per day. That is the recommended allowance. But drinking more than 2 glasses per day for women can be harmful, and for men taking more than 3 glasses can be harmful. The first hampering organ is the liver, where you start having liver cirrhosis, and that can cause liver cancer. So apart from that, there are some other your associated conditions, like there may be high blood pressure, there may be depression, especially in women. They can be cardiovascular diseases more easily, then brittle bones, and can also be cognitive dysfunction, which we call as memory loss. Okay, so these are some highly risky symptoms, conditions which can take place which time if you are consuming it on a in a say abusive manner. But abusive manner, if I say, that means you are taking it as a drug abuse. Drug abuse means you are intentionally taking the drug knowing of all the circumstances that it can lead to you on long run. But when you're misusing it, you may not have the proper knowledge, and then you need to be counseled. Counseling can be done in both the cases, but it takes a longer time to come back to your original state after the counseling in case of drug abusive person, whereas a drug misusive person can easily come back to their original state of your condition. So let us find out some your short-term health risk problems. So, excessive taking of alcohol can be causing some immediate side effects, which can be very much harmful for the lifetime. Okay, like for example, the injuries. If you are riding or driving, consuming alcohol and driving and riding is strictly prohibited, you know that. But if you are doing it, you may be at a chance of injuring yourself and other people also. Apart from that, if you are going to some play, having fun outside, and you are near to some place where there is a height or riverside or seaside, so you may accidentally drown yourself or fall from the height. So you should be careful that if you are in a proper sense of state or not. Apart from that, if you are doing some kind of habits, you are having some cooking habit, you're doing some cooking, or you're doing some kind of laboratory experiment where there may be a chance of you're injuring yourself through some chemicals or burns and acids, so you should be careful at that moment as well. Next is some domestic violences and societal violences. So there may be some domestic and societal violences where people can take the violence up to themselves, self-violence or violence upon others. So that may include homicide, suicide, sexual assault and intimate partner violence as well. Next is about alcohol poisoning. So see, when your concentration of alcohol is more in the blood, and that becomes highly toxic, so that toxicity cannot be is not bearable by your body, and that time you suffer from alcohol poisoning conditions. So immediate withdrawal of alcohol from the blood is necessary. So apart from that, you may also undergo through some high risk behaviors where there may be unsafe sexual behaviors taking place, and your unwanted pregnancies may also occur. And more often in women who are pregnant and they are alcoholic, so there are more chances of having miscarriages, stillbirths where there is the death of the baby right at the time of delivery. And also there may be the condition which we call as FASD. So that is your fetal alcoholic spectrum disorder. What is this fetal alcoholic spectrum disorder? This is nothing but the exposure of the fetus to alcohol when the mother was consuming alcohol, which is also going inside the fetus, and as such the baby after birth is exposed to alcohol, and that is where different types of neurodevelopmental disorder, psychological problems, birth defects may start taking place. Okay. Next we come to about the long-term health risk problems. So these were earlier discussions were on the short-term health risk problems, where even if you are taking it for a short-term basis, but immediate side effect can take place which can be in the long run harmful. And here are some long-term health risks which can take place where this can risk your life, health for a longer duration, irrespective of any accidental occurrences or any behavioral disorders. Like for example, if you are taking alcohol for a longer duration where you are abusively you are taking alcohol, that time you may suffer from high blood pressure, heart diseases, stroke, liver problems and digestive problems where there will be malabsorption. Okay, you will be weakening your immune system. Okay, and that will be more prone to your disease conditions. Okay, you will be more prone to be sick. Then there will be cognitive dysfunctions where you will lose your ability to judge, learning ability, your ability to take decisions. Okay, so that can be also a symptom which is associated with, in the long run, dementia, and that can cause you Alzheimer's disease as well. So your performance in your school will be poor, your performance in your job place will be poor, there will be more risk of getting unemployed easily, family problems will start taking place, And most importantly, a person who is misusing the drug is at a chance of getting easily recovered, but a person who is abusively taking it in a very chronic state where there are more chances of having this type of long-term health risks. And at that time, that particular person becomes dependent on alcohol. So what we call it as your alcohol dependence, or we can say that the person is having disorders associated with alcohol use. So this is highly important that we try to avoid this particular bad habit. So some other particular problems where the people are finding problems to deal with, whether in terms of their health condition, comorbid issues, or with their ages. So what are these parameters which we should take into count while we are deciding to take it as a habit? So people especially are prohibited from drinking are under this category, like those who are younger than the age of 21. Pregnant and expecting women should avoid drinking. Those who are driving learners, or who are participating in other kind of activities, societal activities, or any kind of personal activities, especially societal activities where your skill and coordination is exposed, so then you should be more alert, and that's therefore you should avoid drinking as well. Okay. And taking certain prescription or over-the-counter medications that can also interact with alcohol. Did you understand this? That means you are taking certain medications which have been prescribed to you by the doctor. Okay, you are taking a Schedule H prescription drugs, and also sometimes you are taking over-the-counter drugs which is not under Schedule H, and you can over the time you can buy those anytime from the pharmacy without the prescription, recommended prescription from the doctor or the physicians. But taking any of these medications while drinking can cause a drug to drug interaction. Okay, so you should be careful about this. So we have discussed about the comorbid issues. So that means if you're having some kind of comorbid issues, for example, you have gastrointestinal problems, ulcerative colitis, you have got some cardiac problems from before, genetic problems about your genetic metabolic disorders. Okay, so any health issue which is already present since long time of your age, and that is what you are trying to take a maintenance dose with, and you are trying to control. So there can also be a thyroid problem. So that is a comorbid issue, and then drinking can enhance the risk of these comorbid issues, which can raise their levels easily. So recovering from alcoholism, or unable to control the amount they drink. So see, difficulty in recovering from alcoholism and inability to control the drink is what you are abusively taking your drink. Okay, so according to the National Institute on Alcohol Abuse and Alcoholism, overdrinking can cause the following health hazards: brain problems, where it interferes with our nerve coordination, okay, your neuronal pathways, and it makes it difficult for us to give that cognitive input, okay, and output as well, where we cannot clearly think and coordinate. Then there may be some heart diseases like cardiomyopathy, arrhythmias, stroke, high blood pressure. Liver diseases like steatosis, okay. There may be alcohol hepatitis, fibrosis, and cirrhosis, and other different types of cancer, especially of mouth, esophagus, throat, liver, and breast. So this is about drinking. So you should be very careful about whenever you are choosing to take your drug, which in the long run can make you addictive. So you should be very much keep knowledge about the drug when you are taking it, before taking it, so that in the long run it does not become an abusive habit for your health. So with this we wind up our class today, and I hope that whatever has been explained, we have discussed in the class today, is clear to you. If you have any doubts, you come to me anytime with your doubts, and most importantly, make sure to make the charts of vitamins that we have already discussed previously, and also minerals, which we have already discussed in this class today. Okay, so with this I wish you all the best, and so God bless you all. Okay, thank you.